Today we're going to introduce you to RenalGuard, the world's only automated fluid management system. By the time we're done, you'll understand how RenalGuard operates, how to set up a RenalGuard system, and how to use RenalGuard in clinical settings. Let's start with the basics of RenalGuard. RenalGuard measures a patient's urine output, then infuses hydration fluid based on that urine output. By default, RenalGuard infuses the same volume of fluid that it measures. This simple balance helps demonstrate the concept. If RenalGuard measures 10 milliliters of urine output, it infuses 10 milliliters of hydration fluid. If RenalGuard measures 100 milliliters of urine, it infuses 100 milliliters of hydration fluid. Let's walk through the components of the RenalGuard system. We have the RenalGuard console and the RenalGuard cart. The console combines the features of an infusion pump and a urine collection system. The infusion pump system includes a weight scale to ensure accurate infusion and provide alerts before the infusion bag is empty, the pump itself, an air detector, and a touchscreen interface. An integrated weight scale gives us RenalGuard's urine measurement system. Each patient also requires a single-use set, which is made up of an infusion set, a urine collection set, and an extension set. The infusion set connects to the infusion bag. This should be a 1-liter bag of hydration fluid, no more and no less. Plastic bags or plastic bottles can be used, but glass bottles are not acceptable. The infusion set includes a drip chamber, inline pressure sensor, needleless injection port, and standard lure lock adapter. The urine collection set is made up of a urine collection bag, narrow tubing, and a Foley adapter with integrated sampling port. You'll notice that the urine line is much longer than a standard urine collection bag to allow RenalGuard to be placed at a good distance from the patient when space is at a premium, such as in a cath lab. If the tubing is not long enough, each single-use set also includes an extension set to give you 3 more feet of tubing. The urine collection set comes packaged with a blue priming adapter that is used for priming. We will review that in a moment. So let's start with a new patient. We want to make sure any old kit has been removed and the RenalGuard is clean and undamaged. We switch on the power button. RenalGuard now performs a short self-test to make sure all systems are go. When the self-test is complete, we get this nice screen giving us the option to begin a new patient or continue with the same patient. We are starting a new patient, so go ahead and touch Begin New Patient. RenalGuard now walks us through the steps to load a new set. Now, go ahead and open a new RenalGuard single-use set and let's load it. You're going to want a new RenalGuard single-use set and a new bag of hydration fluid. Open up the set. When you do this, it's best to be wearing gloves. When you first open the set, you'll find 3 bags: the infusion set, the urine collection set, and the collection set extension. Examine the sets to confirm that nothing was opened or damaged during shipping. Let's start with the infusion set. Take the cap off the end of the infusion set and spike the hydration bag. Hang the bag from the infusion bag hook and make sure the bag hangs freely. Squeeze the drip chamber and fill it to the top to keep air bubbles from getting into the infusion line. Make sure the clamp on the infusion line is open. There's a check valve in the set, so we're not going to get free flow. Be sure to remove the tape. Now open up the pump door and thread the infusion set through the pump. You'll see a 1, 2, and 3 on the console. They correspond to a 1, 2, and 3 on the infusion set. Put the 2 and 3 around the air detector and push the tube in there. Make sure the 1 is lined up and close the pump door. Now connect the pressure transducer marked 4 into the transducer receptacle also marked 4. Make sure the connector is fully seated. The connector can be inserted in either direction. The infusion set is now installed. Drape it on the console to keep the end from dragging on the floor. Now let's open the urine collection set. Hang it from the white plastic hook on top of the bag on the long urine collection chain hook. Locate the two yellow bands on the urine collection set and pop the tubing between them into the front of the chain guide. You want yellow, black, yellow, like a bumblebee. Very nice. Make sure that the bag hangs freely without touching the floor and is tucked inside the bag guard. Ensure that the urine chain hook passes through the chain guide to minimize excessive swinging of the bag, and that the urine bag is closed. If you want to use the extension set, now is a good time to put that in. Unhook the two large bore lure connectors on the urine collection set and add in the extension set. Now we're going to prepare for priming the set. Take the cap off the priming adapter and take the cap off the infusion set and connect the two together. This is going to allow us to prime the set in a minute. Be sure not to over-tighten the connection. Okay, let's make sure everything is installed correctly one more time before we continue. The infusion bag is hanging freely, our drip chamber is filled, and the clamp on the infusion line is open. The line is installed in the pump. Our 1, 2, 3 are lined up. The tubing is in the air detector, and our pressure sensor is connected. On the urine collection set side, the bag is hanging freely from the plastic hook, and the tube is installed correctly in the chain guide with the bumblebee. The bag is tucked inside the bag guard, and the urine bag is closed. Lastly, the priming adapter is connected to the Foley adapter and the infusion set. You're ready to prime. Once your set is correctly installed, drape the tubing on the console to prevent it from dragging on the floor and touch Start Prime to begin priming. As soon as prime starts, you should hear the pump running. Prime performs a number of important functions and takes about 2 minutes. Prime fills the infusion set and urine set with saline and tests all of the RenalGuard's functionality, including the pump, weight scales, air detector, and pressure sensor. During prime, please don't touch either the infusion or urine collection bag, as this may cause the test to fail and have to be repeated. You can tap the set to get out any bubbles that have been trapped. Once prime passes and the pump stops, you will see this screen. Examine the infusion set to ensure no air is present and the set is not leaking. If air remains in the infusion set after prime, use the Advanced button to remove it. Press and hold the Advanced key to run the pump to purge air from the infusion set. Warning: air detection is disabled during Advanced button operation. The Advanced button must not be pressed while the infusion set is connected to the patient. Prime uses about 150 milliliters of fluid out of your hydration bag, so remember to take that into account. You don't have to empty the saline out of the urine collection bag at this point, but you can if you want. To empty the urine bag, pull the tube out, slide the blue piece across, drain the fluid, then push the blue piece back in and tuck the tube back into the bag. We are now ready to connect a single-use set to the patient. Any size Foley catheter can be used. Kink the urine line, if possible, to prevent the saline from draining into the bag. Keeping saline in the collection line improves the accuracy of RenalGuard's urine measurement. Disconnect the blue priming adapter. Connect the Foley connector of the collection set to the urinary catheter. Connect the lure connector to the patient's IV. The ideal IV cannula size is 18 gauge, 3.8 French. No cannula smaller than a 20 gauge IV catheter, 2.7 French, should be used. Smaller cannulas will not allow the high flow rates RenalGuard can produce and may result in occlusion alarms. We are now ready to start. Simply touch the Run button and the console will begin balancing. Since we haven't adjusted any settings, RenalGuard will simply match milliliter for milliliter as we discussed at the beginning. There are a number of settings that can adjust the RenalGuard's infusion profile. For now, we're only going to look at the bolus setting. Bolus allows you to infuse an additional bolus of hydration fluid over a 30-minute window. This fluid is over and above fluid infused for matching. To adjust the bolus, touch the setting button, then Infusion, then Bolus. Use the arrows to adjust the bolus setting up and down. When you have reached the desired setting, touch Save Setting to store the setting. If you do not touch Save Setting, the setting will not be stored. You will now see the bolus setting appear in the Settings section. Let's walk through the values displayed on the screen during operation. Total infusion, total fluid infused by the RenalGuard since the start of treatment, total urine output measured by the RenalGuard since the start of treatment, total other intake infused into the patient by other sources since the start of treatment based on user input, fluid balance, calculated fluid balance based on this formula. Fluid balance equals total infusion plus total other intake minus total urine. RG AIM, short for RenalGuard AIM, desired fluid balance based on user settings. Settings displays current user settings. You can see the bolus we set earlier is displayed here. Urine rate, filtered urine rate based on the last few minutes of urine output. Device mode displays the current console mode, run, stop, or pause, and the mode time. The lights to the right of the mode provide a visual indication of the mode, moving green for run, flashing orange for pause mode, and off for stop mode. The AC status indicator lets you know whether the console is running on AC or battery power. The battery charge indicator provides a battery charge status. The infusion bag should only be replaced during stop mode. If the infusion bag empty alert sounds, the alarm can be silenced by pressing the silence button. Press the clear alarm button to clear the alarm display. Replace the infusion bag and press run to resume therapy. Stop mode can be entered anytime during operation to replace the bag before it is empty. During operation, make sure the console is in run mode. Press the stop button, replace the infusion bag, and press run to resume therapy. The urine collection bag should only be emptied during the pause mode. Pause mode can be entered either after the urine bag full alert has been displayed or any time during operation. If the urine bag full alert occurs, press pause, empty the collection bag. During operation, make sure the console is in run mode. Press the pause button, empty the collection bag, and press run button to resume the therapy. During the pause mode, the infusion pump runs at the minimum hydration rate to continue a minimum hydration and to keep the infusion access open. Urine measurement and matched replacement are stopped during pause, so do not stay in pause mode any longer than is necessary. Press the run button to resume therapy. Now let's walk through some of the alarmed and alert conditions that can occur with RenalGuard. If an alarm occurs, the system enters stop mode. The pump stops, you will see a red bar, and an immediate action is required. If an alert occurs, the pump will continue operating, you will see a yellow bar, and prompt action is recommended. Full occlusion. If the console detects a full occlusion, the pump is stopped and the infusion occlusion alarm is displayed. Intermittent occlusion. If the console detects an occlusion that comes and goes, the pump continues but the intermittent occlusion alert is displayed. Potential causes of occlusion are a kinked line, an occluded catheter, the patient is resting on the line, or the patient's arm is bent. Air detected. If the console detects air, the pump is stopped and the air detected alarm is displayed. Press the clear alarm button. Potential causes of air in the set are movement of the console, infusion bag change, a crack in the set. There are two ways to purge the air. Disconnect the patient and use Advance to flush out the bubble, as demonstrated earlier. Or open the pump door and use a syringe to remove the air through the needleless port using good hygienic technique. Press Run to resume therapy. The default minimum urine rate is 150 milliliters per hour. If the urine output is consistently below the set level for 30 minutes, an alert will sound and the following message will be displayed. Note that it is very common for this alert to occur during the beginning of RenalGuard therapy, prior to the administration of a diuretic. Urine bag not detected. Ensure the urine bag is on the hook. No pressure sensor. Ensure the pressure sensor is connected. If the pressure sensor is connected, open and close the door. System fault. Turn the console off and then back on. If the fault repeats, remove the console from service. RenalGuard has an integrated battery that should provide at least 30 minutes of operation unplugged. In many cases, a fully charged battery can last 3 hours or longer, depending on the pump speed. When the console is unplugged, the screen dims and the plug icon shows a line through it. The display in the bottom right of the screen provides an indication of remaining battery power. When an estimated 30 minutes of battery power remain, the low battery alert will be reported. When that occurs, plug in the console. If the console is not plugged in after 30 minutes, a low battery alarm will be displayed, and the pump will not operate until the power is connected. To charge the battery, plug in the console to a hospital-grade plug to ensure proper grounding. Also ensure that the switch on the back is on, the 1 position. When the battery is charging, the LED on the front panel will go on. Now that you understand how RenalGuard is set up, let's discuss how RenalGuard integrates into clinical practice. For the purposes of this training, we will review how RenalGuard was used in the Mythos trial, which showed that RenalGuard significantly reduced the incidence of contrast-reduced nephropathy in high-risk patients undergoing cardiac catheterization. First, prime the RenalGuard console. Then place the patient's Foley and IV. Once everything is set, connect the infusion line to the patient's IV catheter and the urine collection lines to the Foley catheter. Set the bolus based on the physician's orders, and touch Run to begin therapy. RenalGuard will deliver the bolus over 30 minutes. Remember that the bolus is over and above the fluid RenalGuard infuses to balance the patient's urine output. RenalGuard will continue balancing the patient's urine output with an equal volume of saline. Once the cath lab is ready to receive the patient can receive their dose of furosemide based on the physician's orders. The goal of the therapy is to induce urine output rates well over 300 milliliters per hour. In the Mythos study, patients who did not achieve the 300 milliliters per hour target with the initial dose of furosemide were given additional doses up to 2 milligrams per kilogram of patient body weight. The high urine flows induced by RenalGuard therapy can cause patients to lose electrolytes, so check the patient's electrolytes following the catheterization. In Mythos, RenalGuard therapy was continued for 4 hours following the last dose of contrast. Once RenalGuard therapy is complete, you can turn off RenalGuard and disconnect the single-use set. The patient's urine output rate may remain elevated, so continue to monitor the patient's hydration status to prevent dehydration. Some important warnings. Use only 1-liter saline bags, no other fluids or bag sizes. Use only new, undamaged, single-use sets. They cannot be re-sterilized. Use hospital-grade outlets and cables only. Sets should be discarded after use. Do not attach other infusion lines to needleless injection ports. Do not service RenalGuard in any way unless properly qualified. RenalGuard cannot detect if the infusion line is disconnected. Not tested with CHF or patients under sedation. Monitor electrolytes if the patient produces high urine flows. Do not use Advance with patient connected. This concludes our introduction to RenalGuard. We hope you've enjoyed this presentation. If you have any questions or would like to learn more about RenalGuard's advanced fluid management capabilities, please contact your local RenalGuard sales partner or refer to the operator's manual.